Good candidates are really anyone, honestly. So people who have exhausted other sort of options for erectile dysfunction or really just want to sort of get off medications or have been sort of growing frustrated with having to do injections, I think are good sort of candidates for discussing, the possibility of having a penile implant. Most insurances do cover penile implants, so we have really good success getting that sort of approved. We always make sure that that is approved before we sort of go proceed with surgery. But again, most insurances do cover this. There are three types of penile implants, sort of in general terms. So there's a malleable implant, so that's sort of just an implant that is always sort of erect or rigid, and that you basically sort of move into position to have intercourse. And then there are sort of two inflatable types. And so there's one is an inflatable type that just has a pump within the scrotum that has a lot of the fluid sort of stored within the rods of the penis. And then there's another one that has a sort of separate reservoir as well that stores water. So the sort of, I guess, in two general terms, the groups are the malleable and sort of just the one that's constantly rigid, and then an inflatable one, which is something that you can actually inflate and sort of bring up to have it be sort of erect and sort of not erect in different states. So the malleable implant will always be rigid, so it will always sort of be erect, and so definitely some patients may not, want that. And then an inflatable penile prosthesis, you can deflate the penis to sort of be in a more flaccid state, which I think patients, for the most part, typically prefer that. The implants are sized to each individual. So during the surgery, there's a sort of ruler device that will sort of gauge how large the penis is and sort of what the girth we can achieve. And then we sort of size it to each individual. So it's a really sort of a unique and individualized process. So it depends on it, whether it's so the malleable, again, as we sort of reference to, is sort of, just moving it up and sort of getting into the position and sort of locks into place. And then an inflatable prosthesis, there is a pump that's in the scrotum. Everything is underneath the skin, so it's all sort of concealed. But that pump, you basically sort of pump up that little device, and then once you sort of achieve the rigidity that you want, then that's it, and it sort of stays in place. And then there's a button that's on top of the pump that then you can deflate afterwards as well. Yes, ejaculation and sensation are the same. So we're not really messing around with the plumbing or the sensitivity of the sort of body. So ejaculation is the same as what you came into the procedure, and then sensation overall is pretty much the same. There may be a little bit for the first few weeks, obviously just having had a surgery, maybe a little bit of change in sensitivity, but overall after that first 6 weeks, patients report that the sensitivity is just the same as it was before. Yes, the implant is completely concealed, and so you can be in a locker room and not have anyone notice that there's anything sort of different about you. It's all underneath the skin. Everything sort of is hidden within the belly and sort of in the penis and the scrotum, so no one will really notice it. So the implant is made up of a material called Bioflex. It's a material that's very similar to sort of our native penile tissues and sort of has that same flexibility. It's been engineered to also sort of, you can soak the implant in antibiotic irrigation or solution to prevent any infections from happening, which I think is very important as well during the surgery. The solution inside the implant is just normal saline, which is basically what sort of a lot of our body is made up of and sort of our blood is made up of. So even if a implant, accidentally gets broken or anything like that, or sort of cracks, that solution is totally sterile and sort of inert and doesn't really cause any problems to the patient. The procedure is typically an outpatient procedure, which is great. It's typically about an hour to an hour and a half procedure. There's just often one incision that's made right in. There's sort of two different techniques, but the technique that I typically employ is called an infrapubic approach. So that's something where you make an incision right above the top of the penis where it meets the body. The incision is maybe about 2 inches wide, so not very long. And that's where all the surgery is done through just that incision to put the implant in. And then that will be closed up with sort of absorbable sutures, so you don't have to have any sutures removed. And then typically we leave a little drain behind to sort of just wick away any of the blood that's sort of in the operative field, and then you can have that drain removed in a few days. But that helps a lot in terms of the recovery of patients as well. So like I said, again, an outpatient procedure, a pretty quick procedure, and a pretty small incision. I usually say that recovery is about 2 to 4 weeks in terms of sort of just having discomfort of the penis and then sort of getting back to your normal activities. I ask that patients withhold from having sexual intercourse for about 6 weeks afterwards. So I know there's always excitement to use the device, but sort of holding off on that initially. But typically I'd say about 2 to 4 weeks in terms of just sort of the pain that's associated with the surgery. You can use the device after 6 weeks from the implantation type. So yeah, these implants typically last about 10 to 15 years. Again, there are sort of, I've seen implants that have lasted much longer than that. And so it's really, again, I think just a matter of, it's a mechanical device. And so it's sort of, some cars will last longer than others. It's sort of, just the luck that you have. So, but most often you see that they last about 10 to 15 years. The satisfaction rates are really great, both for a patient and their partner, upwards of 90 to 95%. And so that's, again, patients after having the surgery, after the recovery period are coming back, extremely happy. With any implant that's put into the body, there's always a potential that there can be an infection of the implant. And so that would sort of require removal of that device. So that doesn't mean that you can't get that device again. Other sort of things is that you can sort of injure the urethra, which is the tube that you pee out of. That's sort of a structure that's very close to where we're putting the implant. That usually doesn't, that can get repaired right away and sort of doesn't cause any problems in the future typically. And then sort of just in the long term, like I said, sort of a device malfunction and that sort of happens sooner than the 10-15 years that we expect. But again, that doesn't preclude you from having the device replaced.